guys, Dr. Mo here, digital nomad physician at digitalnomadphysician.com. Check out my cool t-shirt. Cuida dos bichinhos. It's this vegan thing, vegan movement here, like cuídate or cuidar de los vecinos or whatever, like take care of the little animals. Anyway, it's cute. It's in Gallego, so I thought I would show it off. What are we going to get into today? I've been researching some telehealth platforms, so specifically EMRs, electronic medical records, that have telehealth built in. And the reason is, if I just want to do telehealth, I can use something like Doximity, which is free. There's a lot of other Doxy.me. Actually, Doximity, I'm pretty sure it's free or super cheap. But then there are some other platforms that I can use that are pretty inexpensive if it just comes to like the telephone or video visit or asynchronous stuff. But I'm actually looking for something a little bit more involved. So I decided to talk about Elation, and the other one is Dr. Chrono. The other one is Cario, and there is Atlas MD. There is Athena Health. This other one is called Practice Fusion. A lot of you guys probably have worked with this in the past. This one is Next Gen Office. This one is Acute Health. And I decided to include RxNet, and I'll get into that for in a minute. And of course, MetCharts, one of my standbys. And then we're gonna get into Google Drive, actually. So basically, if you're like kind of like a TLDR sort of a thing, all of these cost about $200-300 a month. Some of them will be as little as 150, but you're gonna get you're gonna be limited by what you can do, whether it's prescribing or patient scheduling. For something that's all in one, you're looking at about $300 a month. Somewhere like if you're going to pay monthly, it's about $350. You're going to pay if you're going to be billed annually, if this works, you're going to be paying a little bit less. That's really all I can tell you as far as all of these. The cheapest one probably is RxNet, which is really what RxNet is a way for you to be able to just prescribe medication. So imagine you don't want to use any of that. You just want to use Doxy.me, or you want to use Doximity, which all have different types of built-in solutions for doing secure telemedicine. Doxy.me, I'm pretty sure is free, but yeah, it is free for unlimited call minutes, meets HIPAA requirements, free BAA agreement, and virtual waiting room. For $35 a month, you also get high definition video. So maybe there is no video with this one. You get text invitation, screen sharing, and group calls. So I think that's a pretty good price. If you combine this with just the ability to do a prescription, which is $650 a year, plus I think if you're going to do controlled, I don't know if controlled substances are included in this as well. So $650 a year, and you basically just can prescribe any medicine to anyone. A lot of telemedicine companies actually use RxNet for that. And I think an honorable mention is this one, practicebetter.io. I know I'm kind of jumping all over the place because I'm just going to give you a brief overview, and then we're going to dive into each one of these. So for somebody who just wants to tune out, the reason I like Practice Better is because if you're not billing insurance, now remember, I'm looking for something where I know I'm not going to bill the insurance. I don't need any billing stuff. I don't need to get complicated. I'm going to do simple telemedicine visits with patients in the US. This is telemedicine, so medical license, state medical license that I have. I'm going to prescribe medications. I'm going to manage them, follow them up, and document stuff, but I'm not going to bill an insurance company. So a lot of these platforms up here just are a little bit more built out than you really need them to. And so for that reason, that's not really what I'm looking for. But I thought this is really good. Practice Better is essentially a electronic medical record for health coaches. And the reason I say health coaches is because they're doing the same thing that we are as physicians. They want to document stuff, they want to diagnose stuff. And so you could start as little as $0, but you have certain limitations with that. It's actually good, you get up to 3 clients. For $20 a month, you get 10 clients. Now, if a client is not active, you can delete them or you can move them. But remember, as a telemedicine provider, you do need to you need to store charts for an extended period of time. You get telehealth video chats, it's HIPAA compliant. You get a food database where your clients can kind of store, food and stuff. So this is something I use for my health coaching brand. But I also wanted to include this one because obviously this doesn't allow you to prescribe medications. I'm not sure about ICD-10 codes and stuff. I don't think so. But it does come with a pretty nifty app for both iOS and Android, and of course scheduling features, which is really popular. So that's the overview. Let's dive in. So basically, probably the first one that I thought I would talk about, because it's so popular and they do such a good job of advertising, is Elation. So obviously for somebody who does direct care and is not really focused on any kind of billing systems, this is great. You pay $275 you pay $275 a month, or you can pay $350 month to month, and you can cancel it anytime. And it's pretty good because they obviously cater to different people, different practice, enterprise, multiple physicians, insurance. So you're doing an insurance-based practice, and then direct primary care, direct care. So all of these are HIPAA compliant. You get telemedicine with it. You get e-prescribing and controlled substances. You get SOAP note documentation. You can still do some billing with the direct primary care, but it's not going to be as intense as with the insurance model, for which you pay more. Practice management is sort of the membership management for a patient who wants to be part of your direct primary care. I'm just doing cash-based, so I'm not worried about that. And then appointment reminders, kind of the patient experience is pretty important. And again, all of these include telehealth, so video, audio, etc. And you can look over here as far as all the different things that they offer. The website's pretty decent, but some of the things that I heard about is that it's not as great as they make it out to be. The customer service is not that great, and maybe you're paying a lot for what you think you're getting. So that's Elation. Dr. Chrono is very popular. They seem to do a pretty good job. One thing that was disappointing is that they don't have their prices listed on their website. And that's always kind of a red flag for me, because this is not, this is a competitive space, right? If I go on Amazon and there's a book and I want to buy it, and I have to go first contact someone, wait for them to contact me back, that kind of defeats the purpose. And over here, in fact, I even tried to contact them, and it didn't work out. There was no information. Nobody. The bot just said, "I don't understand what you're asking." It's like, how much do you cost? So they're sort of doing the same thing. But anyway, I did some research, and you basically start at around $200. It's kind of a basic. It goes up to like by $50 increments. So $200 a month, $250 a month, I think $300, $400 a month or something like that. And basically you get telehealth. You get the patient check-in, check-out kiosk. You get the patient portal, so the patient can check their labs, etc. You get credit card processing. Most of these have some sort of processing gateway, payment gateway that you can use. Email reminders for the patient, incoming, outgoing faxes and text messages, etc. So you have to pay a little extra to get EPCS, which is basically controlled substances. Otherwise, you can get some basic prescribing, which actually is more than enough for me. I'm not prescribing any controlled substances. I don't think. I mean, I guess I might, but that's not the plan. And so, yeah, I mean, everything else in the bottom is sort of a dedicated account manager and denial management for insurance, which doesn't come towards later. That's kind of like the billing aspect of it. So, yeah, I don't know. The website wasn't that impressive. Kind of some of the stuff they talk about is sort of wishy-washy, maybe not really like directly to the point. Like they don't really understand the pain point maybe of the person who's paying money. So that was sort of interesting. They want you to reach out to someone to get it. So you got a screenshot of the online scheduling part. You get a free trial, which is really good. But beyond that, I wasn't impressed. Cario is decent. I think their setup was the same. I couldn't get any cost information from them. So Cario does a similar thing. It's a lot about billing and insurance. So maybe not exactly what it is that I'm looking for, but you can do payment processing. You can do denial management for them. And then for pricing, you have to contact them. So that's sort of frustrating. Everywhere that I went, the website is really outdated. And that was kind of another big downer for me. And it doesn't seem like the copyright was updated. So yeah, so if I click on pricing, it says, please fill in your information. And obviously that's not gonna happen. Atlas MD was great. Atlas MD is obviously very well advertised. They have very good support from everything that I hear about them, but they're $300 a month. And you can kind of find out everything that they offer you for $300. So access to the internet capable device from modern browser. So it's a browser-based device, so it makes it kind of easy. You got a 30-day free trial. You got a support team, phone calls, text messages, and it looks like a streamlined billing system without the use of third-party payers. So they have a billing service as well. And then features. So Atlas MD is sort of, I think, mostly designed for a direct primary care physicians. I could be wrong, but obviously it is HIPAA compliant, comes with an app on a tablet, and you can see it pretty well because obviously it's web-based, so it's going to be a lot easier in that regard. Helpful details. So here's the scheduling. Yeah, that's what I liked about them. They have some screenshots of what their product actually looks like. I mean, that's kind of important, you know. You're buying a service where you're going to interact with the software 24/7. If you're not putting that out there on your website, chances are it's not that good. So eRx, you can prescribe medications. If you're prescribing from your office, you can have an inventory. That's kind of cool. Then the billing practices such as credit card payment gateways, online bank payments, set recurring fees. So that was cool. So that's for the direct primary care people. And then, yeah, the social aspect, kind of doing the whole video, telephone, SMS. It integrates with some fitness apps, apparently, and you can import your data from a previous electronic medical record, but I think you may have to pay to integrate that. I don't know. Most of the time, it doesn't make sense to do that. For people like us who are doing cash-based, just a few patients, not going crazy. We're not working 100 hours a week. Lab integrations for $300 a month, that's really good. A lot of these other ones, you end up needing to pay a little bit more for lab integration. So this was just a good website, well done, answers my questions. I see the price. Yeah, Atlas MD for $300 a month. I don't know. That's a pretty good deal. So I'm actually gonna put them ahead of everyone so far. I'll probably, we'll rearrange these three. I'm not that impressed with them so far. I've worked a lot with Athena. You guys have probably worked a lot with Athena. Athena is really pretty. It is intuitive, but it is really bloated. It's great for an insurance-based model where you're doing billing and coding and medical decision-making and stuff like that. I thought this was funny, so I was trying to figure out how much they cost, and I landed on this page. This is our cost and value, $0 of hidden fees. Well, I understand that you're trying to not be hidden, but by hiding your price, it's pretty disappointing. So they got all the same stuff, electronic medical record, billing, they got access to Hippocrates, which is, I don't know, like if you don't have access to UpToDate these days, I wouldn't put Hippocrates up there. Care coordination with other providers, patient engagement with a patient portal. Again, you got to fill something else out here. This part where you look at OBGYN and like special practices, it just really wasn't at all helpful. The chat was terrible. And that kind of tells me a lot. Like if chances are the customer service for this is not going to be very good. The reason I can tell is because the chat was useless. I couldn't get any information. And if you can't get much from the chat, maybe that's a reflection of other stuff. So why choose us? Pretty generic stuff, nothing useful for me. I've test driven this many times. So yeah, anyway, we'll keep this. I'll just say Athena is a little nicer, so I'll put it up here. I'll definitely would put Dr. Chrono over Elation. No, I'll put Elation over Dr. Chrono. Okay, so this one is Practice Fusion. So let's take a look at $149 per provider per month. Annual commitment required. Bill monthly. Does not include taxes. Don't quite understand taxes when it comes to a service. E-prescription includes EPCS, templates for charting, quality initiative, cloud-based automatic updates, free customers. This is crap. Of course, there's updates. Free customer support. There should always be free customer support. It's a software. I mean, it's a web-based thing. Labs and imaging, and includes provider licenses. One thing that everybody has to be careful of when you use EMRs like this, a lot of times they're like, oh, if you want to use this, $50 more, $20 more, $50 more, $70 more. And the reason is they often use somebody else's API or package or software, then they just white label it for themselves. So you're just paying another person essentially. It's very frustrating for me in this day and age. But yeah, here you go. So this is kind of like, looks like 3 signing staff and 1 provider. Has really poorly done, but it looks like you might get signed chart notes. So I guess if you're supervising a PA or an NP, which, I mean, they can just fill it and then you can document underneath it. I don't think there's a reason to pay for that. And then let's look at pricing. $49 a month. But again, I don't know what else. Like, where is there telemedicine? I don't actually remember that part of it. So Practice Fusion, again, these are the basic things that should be outlined for an EMR trying to compete in the 2022 space. So I will definitely put this really, really far down the list. I just don't think they're EHR, charting, electronic prescribing, and labs and imaging. So I actually don't think they have telehealth. So maybe that's why they're so cheap. Pretty bad in this day and age. Next gen, yeah, I think a lot of old school people still use next gen. You can see the website is quite outdated, easy to use reporting and analytics. Most of us probably not going to look for analytics. Cloud-based EHR, almost all of these are cloud-based EHR. They're telling you how much money you could save by using them and how many people use them. But if you look, it's a lot of chest, like puffing out your chest, but there's no information about what problems it would solve for the physician. There is no screenshots. Talks about products and services. Nothing. There was no pricing on this. There's specialties. Okay, let me click on urgent care because that's what I'm doing. Next gen says it's award-winning. So obviously I should pay for it, right? It's award-winning. No, this is terrible. This is pretty much just cookie cutter for different specialties. So yeah, so this obviously is not, it's a software that exists. Somebody bought this company and just wants to keep it going. And so they're just servicing the existing clients and just maybe managing the turnover. They're making enough money, probably outsourcing everything to another country. So not very impressed with this at all. And then finally, you have Acute Health. Acute Health is a newer player on the scene, and they're sort of trying to come in for the startups, healthcare startups, so someone like myself, somebody who doesn't want to pay a lot. So what you get is you get 50 cents per active patient per month, unlimited usage. You can do e-prescribing. They give you telemedicine, intake forms. Intake forms are really big, by the way, and most places will provide it, but some of them at the lower end don't provide it, which is kind of a big deal. HIPAA compliant, email support. Is there a minimum charge? $50 a month. Is there extra charge? Extra prescriber cost $25. Do you follow EPCS? We charge an extra $15 a month to cover our costs. So yeah, okay, that's fine. What is considered an active patient? Prices active by patient. What if I am not a membership clinic? No problem. Right, they're setting themselves up for membership. That is true. Fax pages, clinical P enrollment. Okay, so yeah, basically for $50 a month, you get this basic thing, and then you get for $200 a month, you get lab, faxing, data analytics, phone support, etc. And features. I thought the feature was good because they actually take you through their screenshot, so you can take a look of what it actually looks like. And I think that's pretty important these days because just like my Gmail is updated and it looks like it's 2022. I think it's important that these things are the same way. So you can take a look at it here. I will put this further up past Dr. Chrono. I will put this up further. But again, this is one of those fast moving kind of startups themselves. So you don't know what they're going to offer you down the road. This I already talked about. RxNet, basically, they're kind of a full suite. You can do everything. So the full suite is $175 a month, but you got to pay extra for two-factor authentication. It's per provider, billed monthly, includes 50 claims. I don't know what that means, but practice management software, and you got electronic health records, you got e-prescribing, you got billing, and you got scheduling. So that's pretty good. Obviously, a lot of these don't say whether they have like a patient app, a patient portal and stuff like that. So I think most of them that don't say it, actually, they're going to charge you extra once you get in it. And I'm not going to waste my time contacting each and every one of these. If it's not already out there, for example, when you look at Atlas, it's already telling me like, yeah, everything's included, right? So that's it. I know what I'm getting. But if it's not there already, I'm probably not going to pay for it. Now, this is really worth it if I'm doing just the ERX for $650 a month, or if I want to just do the EHR for $100 a month. So basically, it's HIT certified. You get e-prescribing, secure document management, customized patient encounter. So you get the EHR and the prescribing. So that's pretty good. For $75 a month, it looks like, I don't understand. 100. Is this cheaper and cheaper? Okay. So this is the most expensive. So I'm guessing you don't get telemedicine with these, or maybe you do. I don't know. So yeah, that part is a little difficult to figure out. White paper, specialties, and their software. So I will definitely put this up maybe a little after Acute. And then finally, I got MedCharts. You guys have heard me probably talk about MedCharts. It's a free electronic medical record created by this one physician. Super cool that he has put in so much effort to just, make this amazing. And I remember this way back in the day when it wasn't all that. And it's really come along beautifully, really, really beautifully. But it is important that you understand that it is very limited. So you don't have EMR. You can do scheduling and patient records. You can do health reporting, which I don't know why. You have prescriptions that you can do, but you have to pay $50 extra. And that's through RxNet, by the way, which was these guys, right? And then over here, you can see there's some issues with the website. It could be my website. Some of my extensions are blocking it, but it's cloud-based, no implementation fee, immediate setup. Lab integration is free through Quest. Anybody can do that, but they actually integrate it, so that's kind of cool. E-prescribing, $50, which I already mentioned. It says here check. It says pending. Email app reminder. Looks like check. I'm guessing that is. I don't know. I think that means it has it. I think, and the cost is free. It's incredible. I use it. I have access to it and I use it. This goes really high up the list. The reason is, even though it may not have telemedicine, it's easy to find telemedicine. We already talked about that. And for $50, you get the RxNet, which you pay that exact same amount from RxNet, so you might as well get it from this guy. So we sort of finished the traditional electronic health record, electronic medical record, which, by the way, are the same term. It doesn't mean they're just the same thing. Let's not forget, my friends, that you can also just document in Google. So here's my patient chart. Here's Michael Smith. And I can go into Michael Smith's chart, right? This is my workspace with Google. So I have a BAA with them. I signed a agreement, so a business agreement, so that everything's HIPAA compliant. For that, they give me HIPAA compliance. So here I would say, guess today's not my typing day. Michael Smith, I can say 1-1, I don't know, 1970, that's how old he is. And I don't know, whatever information, phone number, address. Oh, it's not my day. All right, come on, Mo, you can do this. And then over here, you can just basically go to the objective section, assessment section, and you can create a folder for that person and document, and then you can collect your payment any other way that you like. So it's not that difficult to do it yourself, but this is really clunky. For that reason, I'm gonna actually keep this at the very end. I think if you have a proper practice, you should not be doing this. And then the reason Doxy is really amazing to me is because you get one of the most important aspects of everything. So if you want to use Doxy with a lot of other platforms, you probably are going to get a much better experience if you're charging cash for your visits than all these other kind of clunky websites. I don't know. They're not impressing me. And I will definitely add this to the top of the list as well. But probably here. And remember, I still have this one as number one, $300 a month, Atlas MD. So that's really everything. There's a lot of other EMRs out there. You can certainly post online where other physicians hang out, Facebook groups, etc., to just get a sense of the different types of EMRs that are available. For me, it makes sense to start small, and once I have a patient and I really need to do a prescribing, I can just sign up for RxNet. If I really need to do a controlled substance, I'll pay the extra fee. So my recommendation is start slow, and once you have the need, then really upgrade. So that's it, guys. I'll put links to the video here, and I hope this was helpful. Take care.